Childhood is a time spent learning about the world, participating in community life, and imagining all of the exciting possibilities that the future holds. But one bite from a mosquito can change all of that. Malaria is one of the most serious causes of child deaths in Africa, killing one child every 2 minutes. Sleeping under mosquito nets every night drastically reduces the risk of malaria. But many people are still unable to access nets or don't know how to use them effectively against this deadly disease. Episcopal Relief and Development's NetsforLife program is a unique partnership of public, private, and faith-based organizations that brings together volunteers, NGOs, governments, corporations, and foundations like the Coca-Cola Africa Foundation to implement programs that save lives. This is part of the fight to end childhood deaths caused by 3 preventable diseases: malaria, diarrhea, and pneumonia. NetsforLife has trained volunteers and government health workers across African countries and has distributed millions of treated malaria nets since 2006. In addition to distributing nets, volunteers educate the public on how to use and maintain the nets to prevent malaria. But education doesn't stop at the grassroots. NetsforLife uses the data gathered by ongoing monitoring and evaluation to engage leaders and to influence policy. Through this integrated approach, NetsforLife reveals the impact that simple prevention solutions can have. Anyone can become a powerful activist and a guardian of the community's health. Nathan is a school teacher who promotes malaria prevention messaging in his classroom. His students take this messaging home and communicate it to their parents. Sawala is a trader who has learned the importance of sleeping under his net every night. Now he doesn't lose income from missing work due to being sick. Kiro trains fellow community members to promote malaria prevention, leveraging his knowledge and empowering others to make a difference and save lives. Madam knows what it's like to have malaria and to lose a family member to the disease. Now she deeply appreciates the net's value, and she uses her personal story to encourage neighbors to protect themselves as well. They say it takes a community to raise a child. This NetsforLife community of school teachers, mothers, traders, farmers, faith leaders, government officials, and healthcare workers is not only raising children, but also keeping them safe. A decade ago, 2 children died from malaria every minute in sub-Saharan Africa. Now, that number has been reduced dramatically because of prevention and treatment efforts. Globally, we are at a tipping point with malaria. We can't stop now, or the disease will resurge and claim more lives. We need your support in the fight to eliminate malaria. We cannot do it alone. Join us to ensure that every child has a chance to reach his or her full potential.